Welcome everyone to the El Paso County Educational Community COVID Recovery Town Hall. It's my pleasure to see you here, either in physical or virtual. Thank you so much for being here. Of all the American institutions the pandemic has shut down, none have faced pressure to reopen quite like schools and universities. That's why we wanted to host this town hall focused on education. The Colorado Springs and El Paso County communities work together, and we are stronger together across all sectors of education. That includes early childhood education, elementary, middle, high school, and post-secondary education. The education community is vast, and the issues we face are complex. Of course, we could never address all of those issues in a 2-hour town hall, but we are committed to serving our community and doing our best to be good partners. We felt it was important to bring together experts from public health and representatives from schools, districts, and higher education. We wanted to address some of the most pressing issues related to the pandemic, and we wanted to do so in a way that maintains health and safety measures for all of our attendees and presenters. We have assembled an expert panel for you who will offer insights and answer questions. I want to thank the UCCS recovery teams for their commitment to planning for a safe return to campus for UCCS. In particular, I want to express thanks to the Community Engagement Recovery Team led by Jen Ferda, Director of the Partnerships and Government Affairs, Scott Smith, Program Director of Emergency Management, and Valerie Martin Conley, Dean of the College of Education, for suggesting that UCCS sponsor this town hall. And to our educators, to those who are involved in the critical work of educating our young people, I know this time is extremely hard on you. I know you're being called to make tough decisions. I applaud your courage. I offer you my thanks. Thank you for being here to learn how you can keep yourself, your students, your families, and your community safe. We're here to support you in every way we can. Thank you. And now it's my pleasure to introduce Dean Valerie Martin Conley of the College of Education, who has been tremendous in this effort and the work she has done to make this event possible, and who will also facilitate our panel discussions. So please join me in welcoming Dean Valerie Martin Conley. Thank you.
Thank you, Chancellor Reddy, for that warm welcome and for your support of this town hall focused on education. I, for one, feel more confident with you at the helm. With your steady hand, I know that we will make it through this challenge together. The College of Education is committed to working collaboratively with all members of the education community. We are committed to doing everything we can to support you. We don't have the answers, but we are here to help. In the interest of time, we will limit our introductions. However, we have put together a document including panelists' bios, which is available in the description in the live stream. To my immediate left, Dr. Robin Johnson, Medical Director, El Paso County Health. Dr. Michael Rashan, Chief of Medical Staff, Penrose St. Francis. Marini Klaber, epidemiologist for El Paso County. Corey Notestein, Executive Director of Student Success and Wellness, Colorado Springs School District 11. Stephanie Hannenberg, Executive Director of Health and Wellness, UCCS. And Dr. Chip Benight, Director of the National Institute for Human Resilience and Professor of Psychology, UCCS. So let's get started. Health and safety are first and foremost on everyone's mind. Having the best, up-to-date, accurate information is critically important to educational leaders and decision makers. So, the first half of our town hall will focus on some general discussion topics related to education and health and safety. Our first question goes to Dr. Robin Johnson, Medical Director, El Paso County Health. Will a COVID vaccine be available in 2020? Everyone wants to know. Who will be eligible to receive the vaccine if there are limited supplies?
So there are over 165 vaccines that are being investigated at this time, and 27 of which are actually at some level of human trials. The science and the immunology genetics that are going into this is quite stunning and actually exciting as we look at it. There are, however, not any at this time that are hopeful to be in use prior to the new year. So the traditional paradigm of vaccine development is allows for kind of a stepwise development. So you start with your vaccine and then the safety and then move into manufacturing and supply. With this outbreak paradigm, that has been shifted, and while vaccines are being developed at the same time, there is a concomitant development of supply and manufacturing to go along with it. So that the beginning of the adoption of any vaccine, there would hopefully be supply that will be available. As far as who will be able to receive that, it is typically decided at a national level, and it is for those who are at higher risk from infection, whether that be due to their medical condition or their job description or where they are on the front of fighting the virus.
Thank you, Dr. Johnson. So continuing with you, what is rapid testing, and is it an effective strategy for contact tracing?
So rapid testing is actually typically more of an antigen test, which means that we're looking for a marker on the virus, where the traditional test that we call PCR is actually looking for the genetic material of that virus. It's used to get a test result within an hour or less. However, it is easier in the sense that you can use just mucus from the nose or the mouth, but it is, while sensitive, meaning if you are positive, we can count that you truly do have COVID. If it's negative, it's not very specific, and so that's not a very meaningful test. If you're highly suspicious that someone does have COVID and they have a rapid test that's negative, it's recommended that they have a secondary test with PCR. The other thing is it's not used for contact tracing. Contact tracing is done through our epidemiologists and the history of exposure. So the recommendation for a close contact of someone who is a known positive case is a 2-week of quarantine. And so a positive test or a rapid test might move you from quarantine to isolation, but that negative test cannot shorten or negate your quarantine.
Last question to you, Dr. Johnson, for now. How does one distinguish signs and symptoms for coronavirus from other common winter illnesses?
That is a really good question because there is a lot of overlap between our symptoms, and that's a question that I think most of us are pondering. But regardless of illness, if you are feeling ill, we encourage you to stay home and across the board to avoid spreading that illness. And there's a lot of that overlap in symptoms, so minimizing your risk for infection is really essential. And we've been talking around our prevention, wearing masks, physical distancing, and hygiene, and all of this brings in the particular need for prevention that we can do today, but we can also plan ahead by getting vaccinated. And so making sure that we have our childhood vaccinations, that even as adults we're up to date on those vaccines, and then getting our flu shot will be helpful in mitigating some of those other viruses that may be circulating that can complicate the picture, but also can make us ill and add to our downtime or interference with our life. The next step is when you're looking at becoming symptomatic is to seek health care early and to be prepared. So understanding your primary care physician, their practice, their clinic, how they, what they have to offer, whether there's telehealth options or that you go in, how they might do the testing, so that you have some anticipation of what to expect as you're interacting with your healthcare professional.
Thank you.
Thank you.
The next set of questions is for Dr. Michael Rashan, Chief of Medical Staff, Penrose St. Francis. So the next question I've been hearing a lot lately, and we will direct it to you, Dr. Rashan. What can I do to manage risk and take more control to protect myself?
I think that is such a key question. While we are all hoping for an effective vaccine that will control the spread of this virus, we have to do what we can each individually do until we get that. You know, the fastest vaccine development that we've ever seen in human history was the mumps vaccine, and it took about 4 years. So even if we can cut that in half, we have a long way to go. The scientists are doing amazing work. We have a lot of hope that that's going to happen, but there is still some uncertainty. I like to look at this from the scientific standpoint. What does the science tell us about how this virus spreads, and how have we learned how to stop it? When it first came out in February, we had no idea. And now we have a ton of experience. We know exactly what to do. It's inexpensive. It's actually relatively easy, and it's amazingly effective. You can look at what's happened in other countries and how they've controlled it. So the virus is mostly spread by droplets. It's close contact in an indoor space with poor ventilation. Anything like that, if you are invited to a crowded indoor meeting with people you don't know, the answer has to be no for now. If you do have to go to a crowded indoor space with people that you don't know, then you have to do everything you can to prevent the spread. Wear a mask. The main point of the mask is if you have the virus and you don't even know it, you could be spreading it to other people, and everybody else in the room could have it and not know that they're spreading it, and that helps you not spread it to someone else. It's incredibly effective, over 90% effective at reducing droplet transmission. That simple act alone will do a lot. Careful hand washing. We know it can also spread from surfaces, so if you touch that surface and then touch your face, you can get the virus. The great thing about this is we know a lot about this virus now. It is really susceptible to any hand washing, to any hand sanitizing. This virus just comes to pieces with hand sanitizer. So careful hand washing and not touching your face, wearing a mask, and avoiding crowded areas is the key thing you can do. The other thing is, like Dr. Johnson mentioned, there's a huge amount of overlap between the symptoms of this virus and other classic respiratory viruses. We've frequently had the idea that, you know, I'm so strong, I'm going to go to work even if I have a little bit of a cold. That has to end. If you have the symptoms of a cold right now, you have to assume it's coronavirus. And the reason is because it probably is. We've seen very little transmission of influenza in this time. In places like Australia and the Southern Hemisphere, they're just not seeing flu cases. 1,000 times less flu than they would have had at this time last year. Because everybody's wearing a mask, everybody's washing their hands, everybody's avoiding crowd space. It works, but what that means is if you've got the symptoms of a virus, you have to assume it's COVID-19. You have to stay home. You have to protect other people from getting it from you. If everyone did that, this pandemic would go away.
So I am removing my mask when I speak, and I'm putting my mask back on when I'm listening to our panelists respond.
And that's great as long as you're 6 feet away from other people. So perfect.
So we have really tried hard to make sure that we have appropriate social distancing between me, the moderator, and you, the panelists, and each other on the stage. So talk a little bit about social distancing. Does it really matter?
It absolutely does. And we don't have to guess anymore. We know. We know that it does. We've seen it work here in Colorado Springs. You remember the massive increase in cases that we were having in March. We were seeing this logarithmic increase in cases. We put in measures to improve social distancing, and after a little bit of a lag, very disconcerting lag, I'll say, if you work in the ER or in the hospital, as we were watching our ICUs fill up, it was a disconcerting lag, but we saw the number of cases go down. We had, at Penrose St. Francis, we were down to no COVID patients in our hospital, and then they started coming back up again. So we know that it works. Other countries, again, have proven it. There are a lot of things we don't know about this virus. This isn't one of them. And like I said, it's not that hard. Distance, mask, hand washing. This is not complicated.
Thank you for that, Dr. Rashan. I'd like to shift a little bit to talking about our youngest population. So can you talk about strategies for kids coping with wearing personal protective equipment, PPE?
It's a hard problem. I mean, we would hope that older kids, in their teens, it would be easier. But I have a lot of sympathy for somebody thinking about preschool and young kids. It's going to be hard to keep that mask on. It's going to be hard to teach them to wash their hands and all that kind of stuff. So I guess my approach is, how do we teach them how to do everything else, right? We model it, right? We tell them why it's important. We show them that the adults are wearing masks, the adults are washing their hands, the adults are keeping distance, and we reward them for doing that, and we redirect them when they're not doing it. It's going to take some work, and not every kid is going to get it at the same rate as others. And so we're going to have to deal with a little bit of that uncertainty. And we have to get used to the concept that there's no such thing as no risk anymore. There's no such thing as no risk. There's always a risk of spreading this virus. There's going to be, for the foreseeable future, there's going to be some of this virus going around. What we have to do is do everything we can to mitigate that risk. So I think that's the way to do it. Explain it to them, model the right behavior. If we had every adult, every politician, every teacher, every figure in this country was doing the right things, then it would be much easier to get the kids to come along.
So how are pediatric patients handling the COVID virus? How severe is the illness in pediatrics and young adults, and what is the potential for transmissibility?
Okay, now we get to the hard questions, I see. Thanks for letting me warm up a little bit. Well, the real answer is we don't know. If you think about the first wave of cases where we have the most experience, it was in the older population. We've seen that demographic shift even here in Colorado Springs. The vast majority of cases that we saw in March and April were in the over 50 age group, and now it has shifted where the vast majority are in the under 50 group. So we still have a little bit to learn. We know that kids are in general resistant to getting severe disease. I'll tell you a statistic that may surprise you. A child is 4 times more likely to end up in the pediatric intensive care unit from influenza than they are from COVID. So in the same influenza that circulates every single year, we see very severe cases in the ER and in the hospitals every single year from influenza. It's 4 times more likely to cause very severe disease than COVID-19 is. The kicker is that if we don't control the spread, there will be a huge number of COVID-19 cases in the pediatric population, and we will see sick kids. We have seen them. It seems a little bit random why some kids get sick and some don't. In general, they tend to get less severe disease than an older population with more comorbidities. There is an instance of this hyper inflammatory state. You have to think about the COVID-19 disease as almost like 2 distinct phases. The first phase is where the virus is replicating and your immune system is trying to stop it. And in the vast majority of cases, it works. It stops the virus. People have a mild or a moderate disease. They get better. And in a couple of weeks, they're fine. In some cases, the inflammatory phase becomes a little bit haywire, and you get overinflamed, and those kids can get very, very sick. It's rare. It's something around 1 in 100,000 or maybe even less than that, but it does happen. My main point is it's worth us trying to protect the these kids from getting any COVID-19 disease, but in general, it's not as big of a concern. We do know that kids can transmit the virus. We also know that people with minimal symptoms tend to transmit less. So the risk of transmission from an asymptomatic kid is fairly low and is fairly easily mitigated by the things we've talked about: mask wearing, hand washing, and distancing. Dr. Johnson, do you agree with that?
I do agree with that. I think that it's important for us to remember that this virus, we're still learning some of those nuances about it. And while, yes, I think the severity among our children is less, if we look at the last 2 decades of flu data, we've had in El Paso County less than 80 fatalities per year for flu and pneumonia, and we are at 136 fatalities for COVID. So it has a spectrum of disease that we need to respect, but that is typically in that 60 and older age group and or those comorbidities that we see that affect the severity of the disease.
So when should I contact my pediatrician if I think my child has COVID symptoms?
Yeah, this is a good question. Naturally, people are going to be nervous when their child is sick. We understand that. I would say a couple things. First of all, try to figure out ahead of time how your pediatric office is working. Are they doing telehealth visits? Are they open for business? Do they have extended hours? Are they open on the weekends? Try to understand that, now. They should have some information out. You can email them or call them to try to figure that out so that you know the best way to handle it. I would say with very mild disease, you certainly don't need to rush in. Again, we're trying to prevent the spread. If you have mild disease, you should assume that it's COVID-19, and you should do the best you can to stay home. You're going to have a scratchy throat. You're going to have a dry cough. You're probably going to have a fever if you're a child. Treat that like you would any other cold. And I would contact your pediatrician just to say you're having these symptoms and plan for the next phase. The one thing I do want people to understand is the hospitals are open for business. We have 1,000 policies in place to prevent spread once you're in the hospital and from sick people. Do not stay away from the hospital just because you're worried about getting COVID-19. That is not wise. Anyone who has symptoms that are rapidly worsening, certainly any difficulty breathing, you need to get in and get seen, whether that's your pediatrician or the emergency department. Every medical office has policies in place to make sure that you're not going to get sicker by going to the hospital. It really is the lungs that we see as sort of the harbinger of when it's turning from the mild disease to the severe disease. Once it starts to cause shortness of breath, you need to get seen.
Thank you, Drs. Johnson and Rashawn, for those responses to our questions. The next set of questions is for Marini Klaber, epidemiologist for El Paso County. Marini, can you describe how schools and public health are working together and will continue to work together during an outbreak?
Sure. So public health regularly works with schools to investigate and control disease outbreaks. This is nothing new to us. So it's just going to be the same for COVID, but with a few tweaks. We take a non-punitive and collaborative approach in working with schools during outbreaks, understanding that schools will be responsible for reporting any cases of illness, either confirmed or suspected, as soon as they identify that. Additionally, when they identify a student, teacher, or staff, they need to also make note of who that person has been around. Working with public health, they need to ensure that those individuals that have been exposed or are sick are excluded from school for the appropriate time frame. And then on the public health side of things, we'll be providing disease control guidance, cleaning and disinfection recommendations, and conducting a disease investigation for anyone who tests positive. We have staff, and always have, who are available 24/7 as a resource to teachers, administrators, the public, hospitals, so that we can appropriately and effectively in a timely manner address any concerns. It's important to understand that each and every outbreak is going to be unique, so public health is going to work with the school and/or district to manage each one as it relates to that particular setting and situation.
So from an El Paso County perspective, what will trigger pivoting to remote learning from your perspective?
So I think it's important for everybody to understand that we are in unprecedented times. We all need to ensure that we're making appropriate plans as parents, as educators, as administrators, for the potential that we're going to need to pivot even overnight sometimes. There are likely to be intermittent disruptions to classrooms or to schools or districts. If a case is identified in a classroom or an other identified cohort, that group is going to be expected to be excluded for a total of 14 days. At the school level, if they're over the course of 14 days, if there are 5 or more classrooms or cohorts, or 5%, no fewer than 10 people, of students, teachers, or staff that are sick, the same will be true. We'll be asked to be closing that entire school, however, for a period of 14 days. At the district level, closure is in accordance with the Colorado Department of Education guidance, and those decisions will be made based upon working with public health and understanding what's going on in the community and how that will affect everyone involved.
So finally, can you speak to how school nurses in particular are engaged in planning or communication on COVID response?
Sure. So public health, again, works with school nurses on a regular basis, and therefore we have engaged with them since back in the spring. We've continued to engage with that group of individuals. The school nurses themselves have a work group associated with preparing for COVID, and our health department staff are participating on that work group to provide the latest information and guidance. Including last week, a team of epidemiologists and environmental health specialists with the health department provided a virtual training to over 100 individuals on identifying and managing outbreaks of COVID in school settings. And this training was recorded, and the slides and recording are available to anyone who would like them.
Excellent, thank you. Clearly, we need a well-coordinated network of support for children to return to learn this fall. Corey, in your role as Executive Director, Student Success and Wellness in D11, and as a licensed school counselor, what are your thoughts about how we can best support our kids and families to be resilient in the coming year?
Yeah, I think resiliency is a piece that all of us have within us, right? And it's often on a spectrum at which we can grow and learn to be more resilient over time. And I think there's not a better time to really thrust into developing skills than right now, both as an adult, both as someone that will model that behavior for my own child, but for the students that I would come in contact with. And the teachers will be doing the exact same thing, whether it's face-to-face or within a remote environment. And one of the things I think that's really important to think about is how do we begin that conversation and how do we get started along those lines, and really establishing open lines of communication and developing a real sense of understanding of what's ahead of us, creating a sense of understanding about the future to the best of our ability. And I know that can be a challenge right now, but it really does help root our students and our staff and the tasks that are ahead. It gives them something to prioritize. It gives them something to ground themselves in. And I think by creating other opportunities within our school settings to allow students and staff to heal, to be heard, to be listened to, and that happens at the teacher level, one-on-one in a class setting. It also happens with the use of school psychologists, social workers, counselors within our schools, focused in on skill development, focused in on community responsive circles coming together to have dialogue that may not be happening in their day-to-day lives at home, that may be happening there, but also having a group understanding of where are we at right now and how will we get through it. And I think what can't be lost is a sense of hope in all of this. We're talking really about being resilient and really when environmental factors are tipping heavily on us and we want to come out with a positive outlook for that or a positive outcome, then we can't exclude hope. I think we have to remain hopeful that we're going to move forward, and we have to help our students understand, our families understand that we're hopeful that we'll be back in a space where we can learn face to face, that we can be together, where mask won't be a permanent part of life, and those things will come back into a space where I don't think we'll ever feel normal again in a while, but I do believe people can feel positive about their future. And I think we all have to remain positive about where we're headed and hopeful where we're going.
So you've touched on this a little bit, but will you comment specifically on the importance of emphasizing social emotional health of children, and in particular if in-person learning is limited?
Sense of belonging is huge, right? And I think all of us as human beings, whether we're adults or children, want to belong, want to know that someone's listening to us, want to be heard, want to be understood. And when there's a breakdown of that, we feel isolated, we feel alone, we feel separated from our peer groups, from our family, and we see the impacts of that in our own mental health and well-being. We know there's increased mental health needs right now in our community, both as adults and as youth. And so I think some of the things that we can do is start to establish those relationships again. And I joke with my colleagues sometimes because when we do come together face to face, they're like, "It's so good to see you." I'm like, "I've been seeing you every single day for hours on end." And for me personally, I feel connection even in a virtual space. That's not true for everybody. Other people need to have a space like this where you can see and somewhat almost be close enough to contact but not contact, right? And that's different for every child. And so even if you're not in a face-to-face experience, you can create a sense of relationship. You can hear somebody out. You can help them start to understand what they might need to do next. Many of our students are kind of like, "What's next?" Many of our families are like, "What's next?" Yeah. And I think through relationships and developing a sense of belonging, that this is my school, this is my community, that we're all actively working together on this, it does start to piece together necessary pieces for resiliency. It does start to get at the ability to develop self-efficacy, right? That sense of control again over my life. Those are the core SEL factors that we'll be looking at. And some of those skills can be done virtually in one-on-one, but you can have group chats. You can have other things put together in a non-face-to-face experience that teachers can do, counselors can do, and really have meaningful dialogue. And sometimes, honestly, we might have more meaningful dialogue now than we've ever had the opportunity before, given the structures that we're often confined with in a face-to-face environment. And if learning looks different, maybe there's more time for this. Maybe there should be more time focused on the relational side of the development of our well-being and students.
Thank you so much, Corey. Stephanie Hannenberg is UCCS Executive Director of Health and Wellness. And Stephanie, you've provided expert guidance to us at UCCS as we have navigated the pivot to remote teaching and learning in the spring semester and as a phased reopening and return to campus for fall 2020. As a past president of the American College Health Association, you have your finger on the pulse of college and university responses to the pandemic. Stephanie, what are the isolation and quarantine plans in higher education generally? And could you speak specifically to what we have planned at UCCS?
Sure. So across the nation, I will tell you there is consistency in people looking at the guidance from their local and state health departments, the Centers for Disease Control, and guidance put out by American College Health Association, and really trying to do what's right for their specific campus. Many are in a situation where they have a lot of out-of-state students, so they are also looking at partners in their community where students can go to isolate and quarantine. I will tell you here at UCCS, because of the makeup of our students, we are more fortunate that many can go home. So we will have students that are able to go home and isolate and quarantine, and those that are unable to, we have reserved numerous rooms on campus that we will be moving them to so that they can be in there by themselves for the entire period, and we'll have their full accommodations and deliver their meals and have an entire plan around that. My concern is it can be very lonely for these students to self-isolate and quarantine, so that's part of why we encourage them to go home if they can, just to have another person in the household with them. It's our job to make sure we stay connected with them daily, provide them those virtual opportunities, because they're coming to college because they want the college experience. And so having them have to be by themselves for 10 or 14 days is going to be extremely difficult. So if we don't do a good job engaging with them during that time, we have to worry about, are they going to follow those protocols? And so, you know, we've put a lot of effort into how do we engage with our students safely, and then in those environments, how do we stay connected with them so that they remain for the entire period doing what they're supposed to do so that we can protect the rest of our campus community.
And talk about our population in the UCCS community. Who are our at-risk populations?
So our at-risk populations are those that come with some other chronic health conditions. So we have students that come with asthma. We know we have students that come that are either in a cancer treatment or finishing it, or diabetes, a variety of other things. Just living in a residential community makes them a little higher risk for contracting it, because we know that they like to share things, and it can be hard for them to keep that social distancing, 6 feet, and wearing face coverings. So in general, living in a residential community makes them higher risk, but those that are in especially higher risk are those that are coming with those chronic health conditions, which we have really tried to educate those families to make sure that they're making a decision that's right for them, securing single private rooms for them so that they have that place that they can go to where they don't have to worry about that social isolation outside of the classroom as much, and just making sure that we're providing them all of the accommodations that they need to keep them safe. But again, educating our campus community about not just protecting themselves, but how do they protect all those that are around them by doing the right thing and wearing their face coverings and keeping that 6-foot distancing. And I keep telling them if they want to avoid going into quarantine and isolation, following those simple guidelines will really help them be able to continue to engage in the campus community.
And what accommodations are we offering? Both, you spoke about some of them in the residence halls already, but also in the classrooms and across campus.
Yeah, so for students that have concerns about their health, they are looking at what options are available to them. We have a variety of options available. We do have the option for a lot of students, they can take online classes. So for those that are concerned about coming to the campus, we do encourage that they explore that until we get a handle on the COVID-19 that's going around. We're also making sure that as people are coming to campus every day, they're being screened. So everybody is asked to do a screening before coming to campus and take their temperature. And if they answer yes to any of the questions or have a temperature greater than 100.4, that they refrain from coming to campus so we can keep everyone safe. And we are disinfecting classrooms. So we're doing it as a campus community, but it will especially help those that are higher risk stay safe as well.
Thank you so much, Stephanie.
You're welcome.
So UCCS recently launched the National Institute for Human Resilience, directed by Chip Benight. Chip, how would you suggest the pandemic is affecting kids and families, and how would trauma reactions fit into the challenges for schools planning for the next year?
So thank you for that question and also the opportunity to talk this morning. I think the biggest challenge that parents and kids are having right now is the unpredictability. I think the stress, obviously the stressors too for those who've lost jobs, and the economic impact is also compounding everything for many, many families. But I think for parents and kids, The challenge typically is that we have this natural dance that we have in families under normal conditions. We all get up in a certain way and the family moves in this dance. And I think the pandemic has caused all that to turn upside down. And so families are often struggling with just the day-to-day operational stuff. And I think summer was a little bit of a gap for that for a lot of families, although camps were different and things that were typical for summertime as well were changed. So as we move into the fall, I think there's this increased pressure on how can we have something that feels normal for us. We don't just have the opportunity potentially to just drop the kids off and have everything be fine. Of course, the anxiety as a parent around the safety of my child when I have them in school is going to be another concern. And then if they're at home remotely learning, there's the challenge there of my own, if I'm a parent with a position, a work environment that I'm working from home, trying to manage the child. I've heard from many, many parents that this challenge has been huge to figure out how to keep the child learning in an effective way and at the same time managing my own work and my own stress that I have. Mm-hmm. So when you put all that into context and then add trauma on top of it, you've now got sort of a toxic soup that I think creates a lot of challenges for families that have no idea what to do. And that is, if you have a child that's experienced a trauma or, excuse me, or a parent that's experienced a trauma, what happens is the whole family can then have this reverberation or impact of the trauma on the family system. And often families, I think, struggle with that alone and aren't aware of resources, people to talk to that can really help them with that. And I think the message that I want to leave today is reach out either to your local school system, teachers should know how to help you with that, obviously school counselors, psychologists, the public health department probably can help you, refer you. We here at UCCS at the Institute, the National Institute for Human Resilience, we can help you with that. So just reach out because there is help out there and we can provide that.
And I think it's really important we continue to get the word out about the Institute. So can you tell us specifically about the GRIT program and its role in community resilience and schools in particular, GRIT for Ed?
Yeah, sure, absolutely. And for all of you listening to this today, what I want you to do is go to the grit.uccs.edu website, that's grit.uccs.edu. And there you'll see a lot of resources just available for informational purposes. We have tabs at the top of the website that provide guidance for certain populations. There's one for parents and youth. But the GRIT program in particular was designed to create resilience within the community by training up anybody and everybody basically on some basic skills on how to reach out and be a support coach for those in your natural support network. And that can work in families in terms of being able to reach out to your partner or to your aunt or uncle or whomever. And we teach very specific skills in there on how to promote strength and resilience and how to provide resources to people when they're struggling. So we give a lot of resources in the training. The training that we provide is 5 hours. It's all automated. You can do it at your own pace, and it's free. And we've had now over 780 people sign up for this. We're in 34 states, 3 countries. We really see that this is taking off because it's easy to do, and it gives you specific skills. We do role plays on the video and so forth, so you see exactly how to approach somebody, how to ask them how they're doing, how to respond. The Grit for Ed program is a little more targeted towards schools, and the basic concept is really to create teams, 3 around me is the concept, of caring adults, basically. It could be a coach, it could be a staff member from the school, it could be a teacher, of course, school psychologist, obviously, counselors. But the idea is to train these folks up on a model of care that can really wrap around the child and create that support system that they may be missing, especially if we go back to remote learning. Because we're going to need to have that which Corey, I think, talked about, that type of wraparound support for kids. So I really recommend folks either take the regular GRIT training or the Grit for Ed training. They're both there. And we're working now with some school systems to try to think about staging these and how to manage it as we move into the fall.
Such important work and such a wonderful service. We thank you.
Thank you.
We'll now turn to our audience for questions, and we do have a small in-person audience, so I want to provide the opportunity if there are any folks out there who would like to step to one of the mics to ask a question. I'll give you that opportunity, and then we'll turn to some questions from our virtual audience. So anyone in the house? So our house members are shy. So while we're waiting for that, I will start with a question from a parent from Lewis Palmer School District 38. With the reports from a summer camp in Georgia where children contracted COVID-19, should children under 10 also be required to wear masks?
I'll take that one.
Wonderful, thank you.
I think you have to have a little bit of nuance. So there are going to be some kids under 10 that can't. Certainly anyone that has a respiratory illness or claustrophobia or anything like that, it's going to be difficult. And again, it doesn't have to be an all or none. I think if you had the majority of kids in the 7, 8, 9 range wearing masks the majority of the time that they're in close contact with other kids, we would get a huge benefit from that. So I would say try it, be flexible. Requirement is probably not the right word, but encouragement is probably the better word. We know it would work. We know it would help prevent transmission, and we know that most of those kids could do it with a little bit of encouragement.
Yeah,
There's no way we're going to get to zero risk. There's no way. But anything we can do to mitigate that risk, we should do.
Yeah, and I think you touched on this already, but it brings up a question from a parent from Falcon School District 49. How would teachers be expected to teach when an 8-year-old probably won't wear a mask?
Yeah, again, I don't think it has to be an all or none. It doesn't have to be every kid wearing a mask every minute of every day. Right. It depends on when you're in those high-risk situations. If you can spread out, if you can ventilate, I don't feel the least bit of risk here, 8 to 10 feet away from my colleagues without a mask. I don't feel any risk. And I also know that I don't have any symptoms. My risk of transmitting this virus to anyone is essentially zero right now. So you have to be careful who you let in the school. You have to try to space them out. You have to try to ventilate. When you do have to do something that involves people being close together, that's when you'd want to encourage as much mask use as you can.
Great.
So,
we've got to be flexible during this.
yeah, if I could add to that,
Sure.
one of the things that we really try to emphasize with these preventive measures is it's a layered approach. And so when you take that whole toolbox together, when you're having difficulty with one of those, say, the social distancing, that's when the masks become that much more important. The other thing that I am always fascinated with is just the innovation and the engagement of our teachers and the way that they find, I think, to help kids with that learning curve. And while these are unprecedented times, none of us have actually lived through a pandemic before or the need to wear masks. It's not culturally something that we engage in where we may see in other parts of the world that there's a more common social interaction with masks on. I think having grace with each other and really helping each other in the process of learning how to do this and to do it well, and find kind of some different value propositions. Have fun with decorating your mask or making sure it matches your outfit, or everybody's going to have a pirate mask that day. I mean, there's a lot of things that I think our teachers will be brilliant in helping to engage our children.
Awesome. From a parent in Colorado Springs School District 11, while sanitizer helps break down the COVID disease almost immediately, my understanding is that it transmits through the air as well. How can air be cleaned while students are in the building? How can we do it safely if buildings can't open windows or doors or maintain physical security when doors are open? Corey, maybe?
I can cover the transmission part. So
Okay.
this is a debate, and it's a pretty vigorous debate about whether or not there is significant airborne transmission. We know certain viruses that are very easily transmitted through the air. For instance, if people in this room were not vaccinated for measles, and I have the measles, then you guys all have the measles now. I don't care if you're 80 feet away from me. Welcome to the world of measles. Measles is very easily transmitted through the air. COVID-19 is not like that, period. It is not like that. There are certain circumstances where we have seen some airborne transmission, but it is mostly droplet. It's mostly close. 6 feet away, hand washing, masks, that's the deal. Many of the scenarios that are thought to be airborne transmission are probably mostly droplet, again, and mostly close contact. If we knew that this was very easily transmitted through the air, like measles, and was causing the problems that it does, we wouldn't be talking about having in-person school, period. We couldn't, right? And again, there's no reason to make this virus any worse than it is. It's plenty bad enough.
Right. Corey, would you like to weigh in on this too?
Yeah, but I appreciate the medical experts stepping in and speaking from a medical expert standpoint, because I'm not one. And I think what some of the families are wondering about is that fresh air intake, opportunities to take a mask off or get out. So I think we can speak to that from my perspective, in that, we do look at the ability of our HVAC systems to bring in greater amounts of fresh air than there currently are. So increasing those capabilities within our school systems become important. Also building in opportunities for students to get out of the classroom, to get outside while it's still nice, take the masks off, play on the playground, still get physical exercise, and then come back in. And so I think, finding schedules that are conducive for those breaks will be vitally important, because I think we're all focused on trying to mitigate the spread of virus as much as we can by using masks. But masks, even for adults, become nuisance to our day-to-day functioning. And so we as adults even want to get outside and take the mask off and breathe. And so I think those are things that schools are looking at doing, have put in place, and are building schedules to accommodate greater opportunities for fresh air.
I think you bring up a really good point about the outdoors. I mean, the bottom line is the outdoors is safe. In one paper that was published looking at 7,000 cases early on in China, doing very careful contact tracing and really looking at how did this virus get transmitted. 7,000 cases, 2 of them happened outside. All of the other ones happened inside. So as much as you can get the kids outside, outdoor classes. We live in Colorado, the weather's perfect here, right? So at least until, say, October. As much as you can be clever, do that. Find a way to space them out when they're indoors, get ventilation when they're indoors, and get outside as much as you can.
I take my 2.5-mile walk every day, so getting outside.
That does more for you than just prevent COVID, I promise.
Right. So this will be our last question for this part of the panel. From a parent in Harrison School District 2, should I be worried about animal to human transmission and vice versa? My son goes to therapy, and part of that is riding horses and walking goats. Is it possible for a human to pass COVID to an animal and then pass that along to another human?
No. So possible, I suppose you could start to look at 1 in a million scenarios. This is not something I would stay up at night worrying about. There have been cases, look, with very, very similar coronaviruses in bats and camels and all over the place. The MERS virus came from camels and lives in camels now. As far as we can tell, this virus came from bats, which is another mammal. So, and there have been cases of household pets that have definitely gotten the virus. As far as I know, there's no case of it being transmitted from a human to a cat and back to a human, or to a goat and back to a human. I just don't think, like I said, there's plenty of stuff to worry about. let's not make it any worse than you need to.
No, I agree.
All right, there's agreement among the panel. But clearly there are lots of concerns out there, and people are just trying to get accurate, up-to-date information. And so that is part of what we are trying to provide as part of this town hall, specifically focused around public health and safety and education. So we thank you, our guests, for being here this morning, and we'll now take a very brief intermission while we set up for the second half of the panel. Thank you.
Thank you.
So we're back, and we're just getting started addressing issues and challenges confronting the education sector resulting from COVID-19. Let's not waste any time getting back into the discussion, but first I'd like to introduce you to the rest of our panelists. First, we have Dr. Michael Thomas, Superintendent, Colorado Springs School District 11, and Joel Ellis, Secondary English teacher from Semla High School, Big Sandy. Next to Joel is Susan Payne, K-12 School Districts and Higher Education Liaison, ECC, El Paso County Emergency Coordination Center, and Executive Director, Safety, Security, and Emergency Management for Cheyenne Mountain School District. Erica Tunson, Principal, Monterey Elementary, Harrison School District 2. Dr. Tom Christensen, Provost, UCCS. Nathan Gibson, Athletic Director, UCCS. And Christopher Knoll, Director of Athletics, Activities, and Physical Education, Colorado Springs School District 11. So the first question of the second half of our panel goes to you, Dr. Thomas. We know it is important to recognize that different districts have different plans for returning or not returning this fall, and that it's not as simple as to return or not to return. District plans have been evolving and continue to evolve. What is D11's plan today, and what will returning look like in your district?
Yes, that is a very challenging question to give a concrete answer, because it is a very organic process for our districts, because we have unique features within our respective communities, but also trying to develop some level of coherence around the region, knowing that many of our families might have students in varying districts. In our district, we've had a strong desire to bring our students back to our campus and have prioritized our ability to do so with our youngest and our middle-aged students, and then looking at more of a hybrid model for our high school. But as you stated in your question, we continually review the health data that is present within our state, and more specifically within El Paso County, and we let our communities know that our decisions on how we open are very subject to change without much notice. And so I know that we are still looking at that data. Last Friday, as we all know, we've had some restrictions put upon businesses. Schools are businesses within this community, so 50% or 100-person occupancy is a real challenge. I can think of one of our high schools that our staff would not be able to even convene because of that number. So how we operate is going to be really contingent on the most recent data, and so we'll be making our final decision by the end of this week in terms of where we were at last week to opening in the fall. But we have delayed by 1 week at this point, so our official start date is August 24th versus August 17th, and again, how we start is going to be subject to change.
So can you speak specifically to D11's plans for ensuring access to learning if we go remote?
Yeah, that's a critical aspect that we need to address, that we know that many of our families do not have maybe devices at home or our ability to procure and image and distribute enough devices in a timely manner before the start of school. So our teams are working on access plans so that we can mitigate any of those inequities that might exist that would prevent a student to engage in our school system. So whether that's bringing hotspots into the community with devices on them to have mobile classrooms. We heard earlier from another panelist that if we can take advantage of the outdoors, that's a very safe and appropriate way to engage our students, as well as, at worst case scenario, providing packet type materials that we can mail home until we are able to procure and image and distribute enough devices to make it a true one-to-one engagement in a remote learning environment.
So rural areas have been hit hard by COVID-19. Job losses, lack of resources that mirrors in many ways the rest of the state and nation, but in many other ways that are unique to rural communities. Joel, as a teacher in one of Colorado's rural schools, Big Sandy's Simla High School in Elbert County, which I've visited and love, what are you hearing from families, and how will you be providing services this fall? What are some of the unique and pressing challenges facing rural schools from your perspective as a teacher?
If I'm at Yuma, where I have a EL population that is per capita similar to District 2, I might be concerned with what happens when we move, if we have to move into distance learning. How is that going to work? I think that what we're going to see is just an amplification and clarification of what we already know to be true. As you stated, resources are an invaluable opportunity for us, and listening to the mental health side of things, we're already seeing a rise in mental health issues with students, and there's a lack of access and opportunity already for them. So as those resources become even less available, what will happen to rural communities in those ways? Culturally, and the safety of students and everything, I think it mirrors what I'm hearing. I live in Colorado Springs, and it mirrors a lot of the same, I'm not sure, I don't know. So there's all that misinformation we're dealing with, but if we can stay in person, rural education is going to be fine. That is where we will thrive. That is where we traditionally thrive. All of our programmatic assistance for students usually happens in just a smaller classroom setting. So whether that's pull-out instruction or everything, that happens with one classroom teacher. So if we lose that ability to be effective in a classroom, I think that's where we're going to struggle. So we're, to steal from Mike Tyson, everybody has a plan until they get punched in the mouth, and I think we're just hoping we don't get punched in the mouth. Because right now feels okay. If today's the rest of the day, we're all right. Or the rest of the year, we're all right.
So clearly, one size does not fit all. And so we've heard an example of a school that wouldn't necessarily even be able to have staff meet given restrictions, to small graduating classes where, the in-person instruction will still be able to happen. Susan, in your role as a K-12 school districts and higher education liaison for El Paso County Emergency Coordination Center, which of course is a mouthful, but it's an extremely important role. You've provided leadership around managing this crisis for the education community. What are some of the lessons learned in continuing to navigate this crisis? What are some of the challenges that you see moving forward?
Well, I think that when this began, when we look at crisis and lessons learned throughout history, managing them, there's some principles that still apply. But obviously, when we're looking at a health-related or a disease transmission and asking schools to do really what looked impossible, part of what we struggled with in the early days of this was really making the decision to extend the spring break time to be able to learn what was happening and to do the research and to work and coordinate with our local experts. So early on, what we wanted to do was streamline information so that decision makers had the appropriate information and that we could also look at the legalities of what was happening. So by doing that, we really identified the key leaders throughout El Paso County. The challenge specifically for El Paso County is that while we are one county, we are not one school district. We have 15 school districts. We have the Colorado Springs Deaf and Blind School. We have the BOCES that operates both for high-level special needs children and behavioral issue students that really rely on those services. Plus, we have more than a dozen charter and private schools that really needed to be connected with our local experts. So in doing that, we really tried to identify the leadership and immediately start a flow of communication between our local subject matter experts and our communicable disease epidemiologists and environmental health at public health so that we could make sure that they were getting the accurate information and being able to make those decisions. What I would also say as a challenge is that the state information, sometimes we would have conflicting information. So we would have to drill down to, is it this or is it that? And for any of you that have ever done a Google search, I would challenge you to a Google search, because when you look at guidance for Return to Learn, you're going to get about 1.6 billion results, and you're going to get a lot of opinionated guidance that's going to direct you in whatever direction you want to go. So our number one goal was making sure that we were working in collaboration and partnership, that we were all on the same team for El Paso County, and that we were working to make sure that we had the science-driven data and that the decisions being made were coordinated and were something we were all part of.
So can you just say a little bit more about how you did it, right? Communication, including public, private, charter schools, and colleges and universities, right? That's a vast and complex network and sector of education that operates in many ways like in silos. So how did you go about doing this and establishing this communication framework?
Well, and I would say it took a lot of people from the Emergency Operations Center. We started with community partner calls. We then drilled down through our Pikes Peak Area Superintendent Group. Dr. Walt Cooper was the president of that, and his lists were instrumental in giving us that basic framework. We then asked for people to opt in. So as we started to communicate through the Emergency Operations Center, we really asked people to come to that Google Drive and opt in with their information. We then broke it down by stakeholder, because we have those that run the business. So we looked at recovery dollars. We looked at immediately, even though we were going to a remote learning environment, we still had to provide food distribution. We had to distribute devices. We had to look at who had Wi-Fi access. So we broke it down by stakeholders and created really identified subject matter groups so that they could obtain their information and we could streamline that effectiveness. We continue to grow that today. Yesterday, we learned of a school system that was not on the list. So as we continue to communicate, I think it was mentioned earlier, the other thing was school nurses. Well, school nurses and counselors are not working during the summer months unless you're in a year-round situation. So we had an opt-in scenario for school nurses in the spring, and we've more robustly, through the leadership of superintendents, made sure that we have representation from all the districts in the last few weeks so that we can share that information. But it is critical because not one size fits all. And when we look at a rural situation and cohorting, we can see that a district with a smaller population is going to be able to establish those cohorts and manage that operation more effectively. And just because of their demographics, where they live, what the numbers are, we do have to be mindful that there might be staff coming into the city where there might be more cases. But being able to manage it with the cohorts and the numbers is something that we just have to be mindful that in a small rural community, it's going to be more doable. As we get into larger districts, we're having to split our size, the class sizes and the contact groups and the cohorts, and it is much harder to navigate.
And you touched on this, but beyond education, what are some of the other issues that had to be managed outside of the instructional mission that schools provide?
Well, I would say, again, we wanted to make sure that those that needed food, and really just an amazing feat with all of the school districts, both in the city and rural, connected so that they could do a geographic map and tell you where food distribution sites were. And that meant that if you needed food for your children, you could drive through and obtain them. We did not go through signing in. We tried to make it as streamlined as possible and as convenient for the person that needed it so that they could go whatever was closest to their home. So that was one, making sure that we had devices. You know, remote learning, not everybody's doing it the same. Also learning about what are the dangers and risks for our students now that they're online and having more screen time. We had to really look at what it meant to be safe online and how we even conducted Zoom meetings or Google Hangouts safely and effectively. What were the procedures that needed to go into that for the person hosting the event or trying to do the remote learning? And lastly, on the behavioral side of things, knowing that students, far more than academic, we have the academic achievement and the learning, but parents also want their children to be safe and happy at the end of the day. So being a very social society, how do we do in this immediacy the shift of social norms? If you think about it, some of us, how long did it take to not have an ashtray on your table? This is probably dating me. But when we're looking at changing the social norms of distancing and not giving each other hugs, not handshaking, changing that with kids, we can all do it if we model it like we're modeling it today. But it is something that we have to do, and we have to be consistent in our practices. And it goes beyond outdoor learning or better ventilation, because no matter what, we still have to keep children safe. So how are we going to provide that safe situation for them to get to school on a bus, for them to leave, to do a temperature check? What do we do when we're at a bus stop and a child presents with illness? Do we leave them there when there's no parent? We have a lot to navigate when it comes to the operational side of schools beyond just the learning environment or academics.
Well, and your contributions to school safety are very well known and appreciated. So let's stay on the safety question for just a second. So what protective safety measures are provided to students and teachers in the classroom?
So we are trying to look at, with the scientists and the environmental health division of the Department of Health, really increasing the amount of making sure that everybody has their face masks, that they have face shields if needed. I would say that just recently there's been some media about the scariness of a face mask and a face shield, but we've seen some creativity with teachers applying stickers or little light up things to make it really friendly and to navigate that. We've also increased the amount of plexiglass so that we can have those plexiglass things that you see when you're shopping so that we can provide that shield when necessary. Changing and taking out a a lot of the clutter in schools, and I hate to call it clutter, but really streamlining and simplifying how many objects there are and making it very simplified so that we can create that radius and that distancing between desks, and we can make sure that we can do that. I will say that one of the things we have to navigate when that comes down is we just also receive the guidance that drills will still be required. So as we're looking at those locations like hallways and people ingressing and egressing, we're looking at one way in, we're looking at one way out. We're looking at where we can have doors propped open for additional ventilation, where we can't. What do we do to decrease touches? So some of those things don't ever happen in a vacuum or a silo. What we've tried to do in this entire crisis is make sure we had a multidiscipline approach to making sure that when we translate the science or the needs of the medical response, we also were adding those layers so that when we made decisions or put out guidance, they didn't have unintended consequences. So navigating that has been something strategic. Some of the simple things like making sure water fountains are covered up, that water filling stations can be used, how we're gonna do lunches. We're gonna do grab and go. We may be eating in the classroom, we may be eating outside. We're gonna try to navigate that very carefully and rotating teachers to the classroom. So when we look at the unique demographics of how to manage this crisis, it is with a lot of innovation and strategic thinking and really that multidiscipline lens, because we really can do that when we all work together. But we also have to navigate this crisis and be able to respond as effectively together.
So last question for you for now, Susan. What challenges and successes have you observed with online instruction?
I would say with online instruction or that remote aspect is, how familiar is the student? How familiar is the teacher? How do we increase the accountability and fidelity of that instruction moving forward? For anyone that's looking at navigating, are our children actually participating? How do we make sure that we are providing the needed professional development of our educators in this very new remote world? For all of us, we've had to learn the different navigations of Zoom meetings and, oh my gosh, my video's on and who's that in the background? Or what am I wearing? I thought I wasn't on camera. So I think it's important that when we look at using remote learning, and I would divert to the Dr. Michael Thomas as well when it comes to the academics, but really the quality and fidelity and accountability of making sure that our students are present, that the time is being spent, that they're participating, and that we have a early warning system or identification if children are not participating. What is our follow-up with students that may be really struggling, that we need to support and we need to reach out to, and we need to have that our educators be that early warning system for those that might need their welfare checked or may not be engaging at all. And if Dr. Thomas wants to follow up on that from the academic level.
Yep, Dr. Thomas.
Yes, I agree with a lot of what Susan said, and I would just add that it's more than just simply putting a device in the hands of a student or a teacher and expecting magic to happen. I want to be very clear, nothing replaces that physical relationship and the bond that a teacher has with their students in the classroom. And when we go online, we want to ensure that our students understand how to interact. That accountability piece is critically important. It takes a very different approach to understanding the pedagogy of teaching virtually compared to engaging physically in the classroom. And giving our staff time to rehearse is going to be very, very important. And that's one of the things that we've talked about in District 11. In addition to the safety pieces that Susan mentioned, our staff are going to need times to be able to walk through the hallways, understand passing patterns. How many students do we typically have down this hallway that we might have to tape off, or putting down squares on the floor to just really practice so that they can model what it means to be in a school during this pandemic without vaccinations of COVID. So I would just add that piece. And then academically, we know that getting our students involved in holding that accountability to, like, even though you might be at home, the expectation this fall, unlike maybe last spring, is going to be there. So your attendance is going to be expected. And even if we don't have a device for them to dial in remotely, we have other measures of mitigating that access so that we can ensure that accountability so that they understand school is still important. It's a viable aspect of your development, and we're committed to that.
You know, there is a lot of fear out there, though. And so amidst the fear that remote learning may be the only immediate option and that students will fall behind in their studies as a result, some parents are turning to pandemic pods and micro schools. Affluent families may be able to hire licensed teachers, while low-income families who are already facing an education gap with distance learning lack the resources to do so. So Erica Tunson is principal at Monterey Elementary School in Harrison School District 2. Erica, as a school principal, you provide leadership on the front lines. How can we increase student access to resources and help minimize the equity gap in education, or at least keep it from widening during the pandemic? And what are your thoughts on these pandemic pods?
Well, first of all, Harrison District 2 is a very diverse district, and equity is what we're always striving for our students. And so in this case, equity really means choice. Our parents had the choice of in-person or e-learning, and the equity gap we're trying to close by providing a top-of-the-line e-learning experience. So each student in our district now has a device. We do also have the ability to provide internet for people who do not have strong internet. Also, we are having students log in for core subjects. They must be present for ELA and for math. So I think in terms of equity and trying to maintain that gap and not increase it during this time, it really is about whether you're in person or whether you're online learning, doing the e-learning portion, you are going to get a top-notch education, not a boxed program, but an actual instructor. There you are part of the class. The teacher can see you on the polycam. You can see your class, and you are participating like anyone else. And that is one way to maybe lessen that equity, making sure everyone has access to the same things. With these pods, and I do know someone who had been asked to be a teacher in one of these pods, it's just sometimes the teachers being asked to do these pods may not actually be have completed their programs or licensed in the state of Colorado. And again, it's just another way that if you have the ability to pay someone, which many families do not have that ability to do, that you're going to get a better education. So I think it's up to districts, especially across Colorado Springs, to make sure that they are providing the top of the line education, that I don't need to go to a micro teacher because what I'm getting from my district is what is top of the line and is what you would get in person.
Thank you, Erica. Can you talk specifically about the special needs students and how we'll support our special needs students as well as our youngest learners, early childhood and elementary students?
So I think that it is critical that we work with our students with an individualized education program. So we are working with those students in terms of if they have chosen e-learning. Every district has a different plan, but I know in Harrison we have developed an e-learner plan that is not a replacement of the IEP, but it is what a teacher can provide to a student who has chosen e-learning. So during that time, the teacher will engage, mostly for academics. Speech pathology has some e-learners out there as well, and they will engage with those students through their e-learner plan, and of course be taking data to make sure that what they are doing is working. At any time when there is more support needed, the school is the best place to get that. So if they are in a program, a special program, some of our CSD and our autistic programming are coming in person, but if a parent chooses to do it e-learning, that provider will do the best they can on an e-learner plan. There are just some services that we cannot maybe do outside of the school. So we're really working with our SPED teachers, taking a lot of data, making sure that they're trying to get all of the IEP goals met through the e-learner plan that we're using. For small children, this is going to be really difficult if you're a primary teacher, because a lot of what we do requires us to be in person. A lot of what we do requires us to use our mouth as we teach people to read. So our district has invested in clear masks for K-1 teachers so that they can see their mouths. We are providing lanyards for them to maybe take off their masks. There's only 3 students at a table, but that allows for students to also practice. There's plexiglass on the table as well to practice making those sounds. I think that that has probably been one of the groups that has been the scariest one for us to attempt to do with e-learning, because we know how important, especially for those kindergartners who've never been in a school environment. We have a lot of kindergarten teachers very nervous. But we have done everything possible in school to provide that, and our e-learning experience will provide the exact same thing for those students.
Dr. Thomas, would you like to weigh in
Sure,
here?
I'll just add, you know, as districts are considering both in-person and remote learning platforms, you know, in District 11, similar to Harrison and other regional districts, our remote plan would also prioritize a hybrid approach for our highest need academic learners. So students receiving special education services, Title I READ-ACT support, ELL, as well as our gifted and talented students. And we know that we'll have specialty academic pathways that our students are enrolled in. So for example, students enrolled in career technology education, or CTE, as well as our IB or AP courses, they require lab experience or physical engagement. And so we will be looking at bringing hybrids of those students back, even if we have to open in a remote fashion, to prioritize those learners as well. And then similar, all the PPE measures would be in our district, and the clear shields, as well as washable cloth shields for our staff, and disposables for our students. So it'll be a unique experience. And again, it's a normal that we're getting accustomed to, but definitely want to just prioritize the fact that, you know, as districts, public school systems, and I would concur, as a public school district in your area, we're guaranteeing that you're going to have FaceTime with a licensed, highly qualified teacher. You're going to be a part of our D11 district, and so when we do come back physically, if we're in a remote start, you're not in a third-party proprietary kind of curriculum or setting. You are still part of that D11 family.
Yeah. So super important that our districts in our area and region are focusing on educating all students in their classrooms. So last question for you, Erica. I know you always try to find silver linings.
Yes, I do.
And I just want to give you an opportunity to share, you know, any opportunities that you've seen related to education innovation in this COVID world.
I've really seen this as an opportunity for educators to really be creative and innovative, because we cannot do what we've always done. So this is really a chance, and this is what I've really championed with my team, just empowering them, be creative, take risks, be innovative, because this is the chance for us to do that, because we cannot fall back on our old ways. Education can be very traditional, and especially public education, but this is the chance that we actually have a device. How long have we been waiting for every student to have a device and bring them in the 21st century? Right. How long have we been waiting for ways to incorporate that technology in a meaningful way, more than just playing learning games, but really having kids engage in that way. So this is a chance for teachers to really use what they go to school for, to use their craft, to really be innovative and creative and come up with ways that new ways to do what we always did. What's a better way, what's a newer way, and how to just really reach each child, because we have that chance now. So I'm very excited for that. That is one of the blessings, I think, of COVID-19. It has made us reimagine schools. And it's been a long time coming, but to be forced to do it, because some of us in education, forcing us to do things is very difficult. But this has definitely been, whether you've been teaching 25 years or 25 days, this is really the opportunity for us to reimagine how we educate and how we educate in our public education systems. And I'm excited for that, and hopefully I have my staff excited for that as well.
Your enthusiasm is very contagious, Erica.
Thank you.
Provost Christensen, I'd like to turn to you now to gain some insight for our audience on the differences and the similarities between adult learners and K-12 for the return to the classroom. What are your thoughts?
I think when you compare the K-12 world and the higher ed world, it is, I mean, not surprisingly, there are going to be some advantages we have, some challenges that we have in higher ed, and a lot of things that are very similar. If we start with some advantages, I mean, you use the term adult learners, and I think that's where our biggest advantage is. One at least hopes when dealing with adults that they can act in a little more independent manner and work on their own. We find many of our adult learners are fairly technology savvy and able to handle some of the things that we are giving them and tasks that they have to accomplish. But we also find some challenges. Certainly one of the challenges is that we have students who are living on our campus. And as a result, we have an additional responsibility to those students. And so we are very carefully monitoring the guidance from the health authorities at the federal, state, and local levels to make sure that we're providing an environment that is as safe as possible for our students, both in the classroom and in the residence halls. And then, as I say, there are so many similarities as well between what we're trying to do in higher education and what the K-12 community is trying to do. We're both trying to come up with the best pedagogical approaches to learning for our students in a challenging time and in a wide variety of different types of topics and classes. We're both trying to keep track of all of those guidances that come at us from many different places and sort through them and figure out what is the good advice and what we can do on our campuses. And lastly, we're all trying to recognize that we are social creatures, and it's important that our students have some ability to have these social interactions, and that we try to figure out ways that, in addition to what's going on in the classroom, we can provide some of that to our students in as safe a way as possible. So some interesting challenges and things that we share, and a few differences as well.
So we've heard our K-12 colleagues on the panel provide comments on the importance of access to equitable learning opportunities, especially during the pandemic. Equity is a concern for higher education also. How is UCCS addressing equity and access issues?
Yes, it's absolutely a concern for everyone in education. And of course, many of the families who are part of the K-12 system in this community also have either parents or students who are part of our higher education system. And so we're dealing often with the same families who have the same issues. There are issues of not having appropriate devices in which to access the internet, or not having high-speed internet, which certainly helps facilitate things. We have tried a number of things that we will be trying here as we come into the fall semester. We've ordered a couple thousand Chromebooks and are distributing those on loan to many of our incoming students to make sure that they have the hardware that they need there. For students who don't have access to high-speed internet, of course, we do have the campus open to students. We do have campus computer labs. We have computers available in the library, which students can come in and use in a manner where we have set them up to be appropriate social distancing and things like that. And then we've also, in higher education, our students need access to sometimes some fairly sophisticated software. Now, while it's available on the campus in our laboratories and our computer labs, we've also made some of the computers in the labs able to be accessed remotely so that our students can get access to some of the more sophisticated software that they may not have on their home computers. So, a lot of issues that we're trying to address to try to make sure that all of our students have an equitable access to higher education.
So last question, Provost Christensen, would you please talk about instructional delivery methods that we're planning at UCCS for the fall?
So the instructional delivery has been gradually changing over time. It was different a year ago than it certainly was when I was a student. When I was a student, we either had, a lecture, a lab, or maybe a seminar class. That has expanded so much, just gradually in time, but with the pandemic, that certainly has forced us to accelerate that rate of change. Online education is not something new. It's something that we've been involved with at UCCS for many, many years. But the amount that we're doing now is certainly dramatically increased, and the ways that we do it have changed. So in addition to those traditional methods that I mentioned at first from my student days, we now have asynchronous online and remote education where students can log in and at any time that's convenient for them to pursue their education. We have synchronous online and remote education where the entire class will gather at one time and be working on the class, but in a remote fashion. We have hybrid education where classes meet somewhat on campus and somewhat online in order to try to take advantages of both technologies and both forms of learning. And lately, the term high flex has been popular, where we try to provide an environment where students can have a choice of being on campus or online as it happens to fit their immediate needs on a particular day. So a lot more ways that we are engaging with our students, and these technologies are here to stay. This will change things after the pandemic has passed. So we'll see where higher education goes from there.
Yeah, more evidence that one size does not fit all.
No.
So our final set of questions is for our athletic directors. Nathan Gibson is the athletic director for UCCS, and Christopher Knoll is the director of athletics, activities, and physical education for District 11. The first question is for both of you. Are we having fall sports? And what will the schedule and playoffs look like? Chris, let's start with you.
That is the million-dollar question. And the answer is we have already been approved for 3 sports. So yes, we will have sports in some capacity. So we have boys golf, boys tennis, as well as softball that have been approved by the governor's office, as well as the Colorado High School Activities Association. So yes, we will have those 3. We are anticipating an announcement today or tomorrow morning regarding the rest of our sports. The Colorado High School Activities Association has called a legislative council meeting today to change our calendar. Currently, we are under a structure where we can only have 3 seasons, and our traditional seasons were fall, winter, and spring. And our legislative council will vote today to expand that to 4 seasons. So we are anticipating, yes, we will have a very small group of fall sports that has been approved, and then we anticipate the rest of them will be approved later. Part of our issue, back to the one-size-fits-all, when you start to move sports around in different areas of the calendar, for some of our larger high schools throughout the state of Colorado, it is not a big deal if you put sports in different places because there's enough athletes that the sports still can go. When you start to look at some of our small schools and our rural schools, you might only have 3 sports for the males and 3 for the females. And so once you start moving those, you might actually cut off one of the sports because kids and their choices. So to answer your question, yes, I know we'll have fall sports in a smaller capacity, but I believe we will figure out a way to have all of our sports. It will just look very different, as you've heard from all of our panelists today.
Exactly.
Yeah, and I'll say similarly, we have plans to resume fall sports. We've already made some adjustments to our schedule as well. Traditionally, student athletes at the college level come back in early or mid-August, and we've pushed that date back to August 24th when we'll resume practices, and then competitions will resume in mid-September. We've seen, obviously, one size doesn't fit all. Our conference, the Rocky Mountain Athletic Conference, has really banded together, and so we'll be playing a conference-only schedule this year, so that's another change for us. But obviously that limits the amount of travel, it limits the amount of hotel and restaurant stays and things like that that we normally would do in a traditional fall. But similarly, we're looking at, one size doesn't fit every sport, and so we're looking at opportunities that will be different for sports like cross country and golf compared to an indoor sport like volleyball or higher contact sports like soccer. And so we have plans and mitigation strategies around all of those. But the short answer is yes, we're planning to resume fall sports. Certainly will look different. And as maybe just a final point, similar to what Chris just alluded to, the thing I keep coming back to is that we have more options this year than we've ever had to resume sports and activities. We could be running a cross-country meet in May this year because the NCAA and our conference and others that will come together in unique ways, and I think that's what's been exciting because at the end of the day we want to make sure health and safety is at the center of all of our decisions, but at the same point understanding how important and just impactful sports can be for our student athletes, and we want to be able to provide that the best we can.
Nathan, will you talk a little bit about the recruitment of student athletes, and will these schedule changes affect that student recruitment?
Yeah, that's a really great question. I think it's one that we've received really regularly from prospective student athletes, and certainly when we saw last spring when the entire country stopped high school athletics, our coaches at UCCS and around the country were saying, well, how do we recruit students now? We can't see them play, we can't evaluate their abilities, and so it changed the game in a lot of ways in terms of what recruitment looks like now. And so the answer to that is I would say this is a unique time. We've never experienced anything like it, but I will also say that our coaches have been more creative in terms of how they build relationships and recruit students. And I think it's important for those prospective student athletes, as you're looking at colleges, to continue to pursue that. Just because a coach can't come to your game doesn't mean that they can't evaluate your abilities at the college level, because it's not just about what you can do, on the court, on the field. It has as much to do with what you can do in the classroom, what type of leader you are, what type of character you have. And so there's opportunities to continue to build those relationships with your coaches over Zoom, over phone calls, whatever it might be. And then when the opportunities come back to evaluate your abilities in your sport, we're going to be ready to go. I like to joke with our coaches sometimes, if there's a kid shooting hoops in their driveway, we're going to find you if you can help us at the college level. But it doesn't matter just your ability in terms of your sport. You have to be able to produce in the classroom. We want to know what type of leader you are. We want to know what type of character you have. And all of those things still mean a lot to us. So that doesn't go away just because you're not competing and you don't have a coach in the stands or in your gym watching you play. So focus on those things, control what you can control, and when we have the opportunity to get back and recruit you and see what type of athlete you are, we're going to take every opportunity to do that.
So I have 2 more questions, one for each of you, and I'd like to ask you, if you might, to just answer them very quickly so that we can leave a little bit of time for questions. So first, Chris, can students still participate in sports if they do not have in-person learning?
Yes, they can. We currently already have it built into our bylaws at the state level for our online students. So we had many students, whether they were attending a charter school that didn't offer athletics, or they were attending a school online. There are state bylaws and regulations that offer those opportunities to kids. And so although it was a small population, we will continue to, we will just expand that population and continue to offer sports to those kids. Yes, ma'am.
Thanks, Chris. And Nathan, I have a feeling this is not a quick answered question, but how do we protect our athletes? And how will recreational activities change for our students?
Well, the quickest I can say is the first and most important thing that I think all of us are doing as athletic administrators are listening to the experts. And you've heard today so many great pieces of advice, so many great nuggets that we are trying to apply to our sports with health and safety of our student athletes at the center of all of our decision making. So how can we apply what we've heard today, the guidance that we receive at the state and county levels, for me at the national level from the NCAA, and looking for those ways to apply what the experts are saying to keep our athletes safe. If we can't do that, then what's the point in participating? But I think there's a lot of great leadership, seeing what Chris has done in District 11 and seeing what people are doing in our community, seeing what people are doing in our conference and nationally, and seeking out the advice of experts has been critical to our decision making. And so I think that's at the core of all of our decisions. And how do we resume? And again, it's about resuming safely, having options for our students, knowing that we need to be resilient, we need to be able to pivot and turn depending on how this thing changes each day. But our ability to do that will give us the option to continue to compete and resume in safe ways. And so, maybe as a quick summary, right, let's listen to what the experts are saying. Let's not just say, hey, we feel like we can do it. The only way we feel like we can do it is if it's in line with the guidance of the experts. And so, yeah, I think that's the quick answer is yes, we want to listen to what the experts are saying.
So we're approaching our time. But there has been a set of questions coming in that I want to pose, and then basically have perhaps our district leadership take away and maybe think about other ways to communicate to our stakeholders and constituents about it. It really is, again, about the balance between in-person and remote learning. And so Cheyenne Mountain School District 12 and teacher in Falcon School District 49 asked about this and wanted to know specifically about kids where maybe 25% or more are likely to be safer at school than they are at home. And are there considerations for how adverse childhood experiences will impact students if they do go online? So, Superintendent Dr. Thomas, would you like to quickly say something in response to that?
Those are great questions, and certainly that's some of the data that we look at, knowing that some of the home environments or community environments that our students are exposed to on a daily basis aren't going to be as conducive than it would be to have them in school. And like I shared earlier, in District 11, we know that we're going to have to prioritize certain learners in our district in a hybrid approach to ensure that we can bring them on campus to bring some of that structure and that stability. I think we heard earlier from some panelists about our food and nutritional services as well, to make sure that we have breakfasts and lunches available to our families. That will continue. So we want to balance that safety of being in person as well as supporting them remotely.
Thank you. That is all the time that we have. Wow, I can't believe how it's flown by. What a rich conversation. And I'd like to thank our panelists for taking time to be with us today, lending their expertise, and to be a part of this Education Town Hall. I'd also like to thank all of our participants, both in person and remote. Be well, everyone. Thank you.